and look forward to your comments and questions about this current research. I'm
Do you
a
want me
health
to introduce
economist.
you? Okay, you go ahead and
Well, do you want me
self-introduce yourself.
to? Whatever you want.
No, go ahead. Please go ahead and introduce yourself. Yeah.
I'm a health economist, have the pleasure of knowing Chirantan previously, a health economist at Stanford, and do work primarily Asia health policy. So this is joint work with colleagues at the University of Tokyo, particularly Toshi Iizuka, and a colleague here at Stanford, Young-Suk Lee. And I will present our preliminary results, both from a national survey in Japan and from talk a little bit about our own original survey of nursing homes in Japan that speaks to this broad topic of robots and AI automation more generally and labor in the service sector, firm level evidence from nursing homes. So I understand we have about an hour, so I'll leave some time at the end. I have another meeting that I'll have to go to
Sure.
at 9 o'clock my time. So, but I'll go through this rather quickly, but feel free to jump in. I don't know what the
Yeah, you can finish up and we can take the
rules.
questions later on.
Okay, so Chirantan, just jump in if I should stop, but I'll just go through to the end. Yeah. So as you all no doubt already know, new technologies inspire different kinds of reactions in many different populations, and actually fear in many countries, including here in my own. And some of that is related to this fact that many jobs are impacted by AI automation and robots and have been for quite some time in manufacturing. And it's not entirely clear how this will play out across countries, industries, services, and so on. And so it relates to our human capital development and many other issues. But it's important to remember that these new technologies, of course, are used because they have many values to economies and societies. And one I'll be focusing on in this research in particular is addressing the issue of population aging and many of the social and economic challenges that go along with this great triumph of longer lives in many parts of the world. And Japan is sort of leading the world in terms of population age structure. So it's a good case study for this kind of research. Of course, automation may also help with pandemic response and other things. We can talk about that in the Q&A, but this is largely focused in the use of robots in assisting with the frail elderly. The current literature is focused mostly on examining the impact of robots in industry, as you may know. So we're trying to figure out, are the effects of robots different in the service sector, and particularly in labor markets characterized by an overall aging of the population, and especially a declining of the actual working age population. So what do we do in this paper? We ask how adoption of robots affects workers in nursing homes in Japan. Specifically, we look at the early phases of technology diffusion. So our data here goes through 2017. Our own survey was collected the beginning of this year, and we know robot adoption is already much more prevalent now. We document the correlates of robot adoption in nursing homes, and we examine the impact that's, designed to be correlations and then causal, and I'll try to argue why we think it's causal. The impact of robots on the number of long-term care workers, turnover, retention of those workers, their wages. Japan, as I mentioned, is a good case study because of its aging population and its leading development of robots, in particular long-term care robots. It's characterized by a relative caregiver shortage and, as you may know, a relatively low reliance on immigrant labor. So our contribution is to provide evidence on the impact of robots based on establishment level data. So we use data from a large survey of individual nursing homes in Japan. And in much of the literature, it's been aggregate data for regions and economies, which can reveal many different things, but some things you can't find out if you don't have establishment level data. It's also, of course, in the service sector rather than manufacturing and industrial robots, and in an aging society where effects may actually be different. So we look at the possible impacts in the context of a growing literature in this field, as you may know. We can come back to this in the Q&A, but there have overall been mixed effects. So briefly, to talk about the issues of displacement and de-skilling, there's a famous paper, Acemoglu and Restrepo, on industrial robots in the US. Besson et al. Has more on automation spending in the Netherlands. It's not clear that this displacement and de-skilling saw less employment and lower wages, whether that is true in all different markets, particularly if you have tight labor markets, you might think there might be a difference. And the effect may be concentrated on particular kinds of workers. There's also a question about augmentation and upskilling. There's evidence of positive impact of industrial robots in Japan, and our own co-author, Young Suk Lee, has reanalyzed some of the data of Acemoglu and Restrepo in more recent years and found that the effects do differ. Adoption positively associated with employment for some studies of the service sector with limited and regional data sets that have detail about that, they have found there might be augmentation, upskilling for particular occupations, professions. And nursing home, that's not New Hampshire or other NH, and nursing home robots may reduce turnover rates of caregivers and increase wages as robots assist with the very burdensome tasks that lead to back pain and so on for these caregivers. So ultimately, the effect of robots is an empirical question. So we bring these questions to data. Japan, as you know, has a growing demand for long-term care, not only a constraint on the labor markets of providing long-term care. So here we show a map of the different prefectures in Japan. And you can see in panel A, the proportion of the population age 70 and over. And you can see even the minimum there, the lightest area starts at 14% and it goes up to 26%. So the percentage age 70 and over is above the percentage age 60 and over in many places, including India. Panel B, we have the proportion of nursing home residents that have substantial functional limitations. So within that elderly population, the ones that are in a long-term care setting and are not able to walk or bathe or feed themselves. And you can see there is regional variation, which is important to our identification strategy, but also very high numbers. Again, the range going from over 50% to almost 80% of nursing home residents that are that frail. It's also true, as you may know, that the overall share of the population in Japan that will be over age 65 is expected to reach 40% in a few decades. So again, leading the world in terms of the demographic transition. Unsurprisingly, once you've seen those demographics, you can think about the demand and the supply side of long-term care and know that the labor market for care workers is tight. There's high demand, as I just shown you, and that the projection is to increase. And although rules have been released, a little bit for immigrant workers, they're still relatively tight compared to many other societies. So the supply of care workers is limited both in Japan and from bringing in workers from elsewhere, such as the Philippines and so on. The unemployment rate generally is quite low. Of course, current pandemic and so on, we're not sure about the short term, but it is true of the relative unattractiveness of this occupation. across many societies. That's the case, of course, not just in Japan. So all of those mean that the supply of care workers is limited relative to the high demand. One indication of that is the ratio of job offers to applicants in this field is about twice the average for Japan. And there's an official projection of a shortfall of 380,000 long-term care workers in just a few years. So let me first talk about the setting, long-term care in Japan. As some of you may or may not know, Japan not only has universal health care coverage, but has universal long-term care insurance since the year 2000. This covers eligible elderly above the age 65, over 6 million as of last year. It's divided in 5 different care levels. As I indicated, already talked about those at the highest level, 4 and 5. This is relatively comprehensive. It covers daycare, home care, and residential nursing homes. Daycare being the way it sounds, that like for children, the elderly reside at home but are taken to a facility during the day and come home. And robotics are also being used in that context. We can talk more about that if you're interested. But this study is focused on residential nursing homes. The government regulates service prices under this insurance program. We focus on 3 major types of the residential nursing homes: long-term custodial care in smaller size and larger size as the main category. And that basically means, as you may know, that the caregivers are assisting with basic activities of daily living. There's also a smaller group that is equivalent to like a skilled nursing facility that is mostly rehabilitation after an acute illness or accident. Then the person needs rehabilitation before they can safely return home. So we look at data on those in the context of an economy that has been subsidizing care robots. This is the opposite of the proposition in the US to tax them, and there are reasons for that in other industries and so on. But actually, Japan has been a leader in terms of robot production and utilization. It is actively deploying and developing robots for long-term care to deal with these issues we just talked about, labor shortages and turnover of caregivers. And the subsidization comes from both the supply side and the demand side of the market for robots. So since 2013, the ministry has identified 8 task and technology areas for which they subsidize deployment of long-term care robots. And prefecture level governments since 2015 have started subsidizing care homes for the cost of adopting long-term care robots. That has typically covered around half of the cost, so the care homes put in part of the cost, and that limit has gone way up, so it's much more than 1,000 per robot now. And it covers many prefectures, but importantly for our identification strategy, it started at different times and the amount of subsidies available to each nursing home differs across Japan. I'll pause for a minute. Any questions, Chirantan?
I don't see any questions right now, so you should go ahead.
Okay, great. So here's some information about robots in nursing homes. What exactly is a robot? We have a specific definition so that we don't confuse it with other technologies. Robots are that can not only sense and provide information, but provide signals so that actions can be taken based on that feedback. And long-term care specifically means that the robot reduces the burden either on the caregiver or on the client, the frail elderly person. So these are the different kinds of robots that are primarily used in Japan. The most common is a kind of monitoring robot to see whether an individual is safe, whether they've fallen out of the bed to alert the caregivers, and so on. There are also transfer aids that the caregivers can wear or put on the client, and communication and bathing support. Importantly, over a quarter of robots, even this earlier time of the survey, have adopted one of these kinds of robots. And the pictures give you some idea of what they are. So for example, what is a robot that is a wearable transfer aid? Here's an example. It's not just a back brace, but it senses what's going on and gives aid in response to the actual muscles and so on. Similarly, here we have the monitoring system, the non-wearable transfer aid, the communication robots, these fuzzy little seal-like things that help, particularly with those with dementia and so on. So that's some idea of what we're studying. Our data comes from a facility-level data set collected by the government in Japan called the 2017 Fact-Finding Survey on Long-Term Care Work. It is an annual survey of more than 8,000 long-term care facilities and includes information on wages, demographics, human resource management, and so on. The data we gathered on prefecture level subsidies, then we linked to that data set. We collected and coded it ourselves by hand from records in Japanese from the different websites and following up at the prefecture level. We have data used here on the 2017 planned number of robots in each prefecture and the ratio of targeted number of robots to number of nursing homes, which we'll be using in our analysis.
Karen, I had a quick question.
Yes.
So is there any reason why a certain prefecture is more friendly towards adoption of a robot historically than other prefectures, which you can exploit in the data? Like maybe there is the presence of a scientific ecosystem and people are more friendly there versus other prefectures. I don't know what it could be, but is there some variation that we can exploit historically here?
Right. Yeah, we have a little bit, and we plan to do more so. So we have information on the prefecture general economic development in industry and demographics going back and going forward, both to look at labor market conditions and this broader industry specific. We actually have started coding the manufacturers of these specific kinds of robots by prefecture, just to look at sort of the political economy of this subsidization. I don't know if that's what you were alluding to. Yeah, but at this point, we know that the subsidies were designed to alleviate some of the labor market stresses as well as to promote the industry, right? So we're leveraging those two things. And we welcome further ideas about what to include. I'll show you what we have included, and we can come back to that.
Sure.
That's a great point. So, but it is related to our overall point that the pace of adoption of robots, it depends a lot on the local legacy, institutional, and technology. And in Japan in particular, they've been adopting this kind of robots and trying to figure out if they work at home, and then also, of course, later we'll be serving other care markets in the region and internationally. So
thanks.
This gives some descriptive statistics. I won't go through anything in detail, but just give you an idea of the size of the nursing homes that we're talking about. Number of nurses, so many fewer than caregivers. So the average home has around 40 caregivers and 7 or 8 nurses. That'll be important when we talk about percentage change. It's much more dramatic for nurses, but that'll just mean 1 rather.
So you are going to show that there is no crowding out, right? You are going to show actually that those who adopt are the ones who have more mean nurses and staff and caregivers. It seems like from the top table.
Well, this is just descriptive statistics.
Sure,
Yeah, I'll
sure,
come
sure.
back to
Okay.
there. There are quite a lot of differences actually between just an OLS correlation and actual causal effects, as you
Okay,
may
okay, awesome.
suspect. So it's true that larger, so adopters tend to be larger and so on. Importantly, we have information about wages which do not differ just in univariate, and the adopters have, if anything, more severe caseload of, but importantly, we can measure robots specifically, and there are other technologies shown here that robot adopting nursing homes also have more of compared to non-adopters. And we have urban rural markers and so on. We can come back to some of that if you'd like. So specifically for those reasons that Chirantan was mentioning and what I just said about many different factors differing across nursing homes, we're using the empirical model that controls for many different things. So here are our specifications. The effects of robot adoption on various staffing measures use this specification where the dependent variable varies staffing measures of the nursing home, overall employees, caregivers, nurses, regular and non-regular workers, which I'll come back to as an important distinction in prefecture K. Robots is an indicator whether the nursing home has adopted a robot or different types of robot as at the time of the 2017 survey. And then we have various characteristics of the facility. Importantly, the case mix of the people requiring care, the kinds of services that they provide. These are overwhelmingly not-for-profit. Actually, legally, they have to be not-for-profit in Japan. The years of operation and other technologies, as I pointed out, whether they're urban, rural, or in a major city, and so on. And since we're interested in adoption of technology more generally and its relationship with management, we have data about management in some questions included in the broader survey and even more in our own individual survey. So that's a question we'll be coming back to, the interplay between management and technology adoption, particularly robots. But this paper, we're focusing more specifically on overall staffing and wages. So our second specification looks at wages, and here it's broadly the same thing, although of course it's worker level, mostly monthly wage here. And then we control obviously for the individual characteristics of the workers, not just gender and age, but their qualifications and their tenure, with their full-time, part-time, regular or non-regular workers in Japan. And we cluster at the prefecture level. So pause there a minute. Any other questions?
Yeah, Dhruv has a question. Is the larger number of workers in robot adopters due to productivity effect of robot adoption, or is there some other effect like increase in demand for services with robots?
So the robot adopters are bigger to begin with. None of those are showing the effect of robots themselves. It's just a correlation. So I'll show you there is a very strong correlation that larger nursing homes that serve more clients and have more caregivers are also more likely to have many technologies as well as robots. We ultimately would like to look at the productivity effects, but that would take a careful identification strategy and then following up. So we're starting to get there with this. We have collected our own nursing home specific data that will get us closer to that, but none of them are panel data at the individual caregiver and nursing home level. No one else in the world, as far as I'm aware, has that kind of data yet. So we're getting there, but we won't be able to say anything specifically about short-term or even long-term productivity impacts of robots other than speculation from this correlation and cross-sectional identification. But thank you for the question.
Can I ask one like supplementary question to that? So that's the productivity effects are on the supply side. I'm sure you're thinking about whether adoption of robots are also changing patient outcomes, right? So you should have something on demand on the side on patient outcomes. Are the elderly feeling better, lesser incidence of diseases, etc.? That could also be captured, no?
Yes,
for
of
the
course,
welfare
it's very,
effects.
very important. The correlation with quality and the impact on
Yeah.
quality. Yes. So as you may know, measuring quality is quite challenging
Yeah.
and very, very important for thinking about long-term care outcomes, as the pandemic has, of course, underscored. Um, that literature in Japan is somewhat limited. And this data set that I'm talking about now also has a limited number of measures for
Mm.
quality. In our original survey that we collected earlier this year, we have much more detailed data on patient level health and outcomes. So part of that is for case mix adjustment. And we will, though, be looking at quality of patients' outcomes. Again, benchmarking it to other long-standing trends in Japan is a little difficult given the lack of data. So that's something to be looked at. I agree with you that we think that part of the adoption is that they can talk about the quality of care as well as retain their staff to sort of
Exactly.
increase productivity and attract consumers. We don't yet have information on that, but we do actually, interestingly, have data on perception about appropriateness of robots in use
That's
and
nice.
and so on. So we look at some of that as a short-term effect, and then longer term we'll be looking at outcomes. I might note that although we don't have, for example, you know, whether they have pressure ulcers and so on in this data, actually the number of staff per client, particularly case mix adjusted, has often itself been used as a measure of quality. So that's something we'll be looking at directly in terms of staffing.
Mm-hmm.
So higher number of nurses per frail elderly, for example, can be thought of as a direct correlate or proxy for
Mm.
quality in some
Mm.
sense. Yeah.
Cool.
Any other questions?
No, I mean, the reason I asked this question is everyone is talking about digital health and telemedicine. And obviously the supply side IO guys are looking at whether it's increasing hospital productivity, but I've been wondering whether anyone is measuring globally the patient welfare effects of this. So, you are bang on. It has to be done. So, anyways, don't want to distract you. And
Yeah,
there's no
we're
other
trying to do
questions.
it. Yeah,
Yeah,
but as you know, it's hard to do.
yeah,
I
yeah,
mean, if it were easy, somebody would have already done it, right?
yeah,
That's
yeah.
research. But yeah, I completely agree. It's very important, and we are trying to go in that direction. You may very well appreciate that now is not a good time to field a survey in nursing homes.
Yeah,
So yeah, we our next steps are delayed for
cool,
obvious reasons. But
cool.
yeah. So
Please
the
go on. Yeah,
identification for this, sorry, go ahead.
please go on. Please go on.
Um, yes, so our identification is, first, we know that adoption of robots may be endogenous. We were just talking about that, affected by other factors such as quality and management. So we use this instrumental variable of the prefecture level subsidies for robot adoption, the planned number of robots per nursing home. To show you what that looks like, subsidies for long-term care robots predict robot adoption. Obviously, there's some variation around the trend, but that we'll be using for the identification. So first, just looking at correlation of which homes are adopting, that you saw hints of that in the descriptive statistics I already showed you. So it is true that even controlling for many other things, nursing home size is strongly positively correlated with robot adoption. Having a human resources manager and seeking to improve wages for retention, those are all things captured in the survey. So indicators for those are strongly associated with robot adoption. Other positive correlates are having a more severe case mix, having the population age 70 or older in the prefecture where the nursing home is higher, and prefecture hires per job listing is positively correlated. So what does that look like? I know it's a little busy, but you may want to see some regression coefficients and standard error sample size. So yeah, I should have mentioned that our sample size is a little over 1,000. So robot adoption is positively correlated with both care workers and nurses. positively correlated, right? So we're not saying that robots mean they hire more workers necessarily, but larger ones are adopting robots. Could go both ways. The relationship is statistically more significant for regular employees, especially regular nurses, as opposed to non-regular employees. We can get into that, but you can imagine that's sort of full-time salary with full benefits versus those that do not have full benefits might be a part-time and so on. There's a whole classification of that in Japan and a trend towards more working of the non-regular employees, especially among women, which, as you may suspect, are a large share of the workforce in nursing homes in Japan as elsewhere. So you can see here, robot adoption is negatively associated with wages, especially for non-regular workers. Again, these are all associations. So that's just looking at the data controlling for facility and prefecture level factors. Perhaps more interestingly, we can try to use our IV strategy, again, where we're using that instrument related to prefecture subsidies that varies across prefectures and over time. And so we look at that in terms of 2016 and 2017 subsidies and how that's correlated with the 2017 reported outcomes at the nursing home level. We would have loved to do this with a panel, by the way, but the survey does not allow linking to individual nursing homes. So that's one reason why we field our own survey. But so this is the cross-section in 2017, and what do you see? Well, with a plausible instrumental variable and thus a plausible causal relationship, none of those associations are statistically significant that we saw previously in terms of size, right? However, robot adoption may lead to hiring non-regular care workers and nurses, this seems to imply, and may decrease nurse wages as well. So that's what we see here in terms of a significant and non-trivial magnitude. That appears to be related to the fact that they are hiring more nurses that are non-regular, or in that regular nurses are actually not working full-time, and therefore the monthly wages are adjusted downward. But importantly, that goes along with a higher number of nurses, non-regular employees in particular. So if we're talking about association with quality, right, we're finding, if anything, that they're increasing the skill level of caregivers alongside this investment in technology, which suggests it might be improving quality and outcomes. We don't know yet, but it's not going the opposite way as it has in much of the study of manufacturing. So again, this is preliminary. We are still writing up and investigating other dimensions that I can talk with you about, but we do not find large or statistically significant effects on turnover of caregivers. Unfortunately, I mean, that had been one of the intended goals of the policy, was to improve the occupation for caregivers and to reduce the very rapid turnover in this occupation. We do not yet find that in this data, but as we follow up over time, and particularly with our own survey, we may be able to get at that. And it is true that with the causal setup, that the report of the nursing home, that they invest in retention strategies. Remember, I showed you that quote from the survey. That is positively associated with robot adoption. So there might be something going on that we're not yet able to identify in the data. But that, the final part of the empirical results that I'll share here are the effects of robots overall on wage share. This has been a debate in the robots literature, as you may know. And on revenue growth, again, this is cross-sectional, but we can therefore look at investments, whether they're planning to expand and get at that from the cross section. And as you can see here, there are not many strong effects. And what we do see is partially mechanical. You might say if the wage share is going down because they're actually spending money on increasing their technology investments. So it is clear that the wage share properly measured would be going down to some extent, although then they're hiring more. So robot adoption seems to reduce the wage share while revenue growth is not impacted by robot adoption, at least not in this setup as an association. The wage share reduction is consistent with the robot purchase and may also reflect a shift towards the non-regular workers who have lower salaries.
So Karen, Pallavi has a question. Do you see any significant effects of robots on tasks such as nighttime monitoring of patients?
Thank you. Yes, that is exactly one of the questions that we focus on our own survey. This survey data, unfortunately, does not have data specifically on the tasks that each of the caregivers undertakes. But we do know that monitoring robots are the most commonly adopted robot, as I showed you there. So we do suspect that if we're going to see any particular impact on outcomes, both for the health of clients and for the caregivers, that it may come primarily from a reduction in the need for the caregivers to go, as you may know, they sometimes go room to room every other hour all night to check on the residents. And the residents often may get up and have a slip or fall at night, and that is a common reason for an unexplained hospital admission and so on. So that is specifically the first set of quality questions we ask in our own survey, relates to that monitoring and nighttime use. We have talked with firms in Japan, as well as some of our own GSB entrepreneurs actually, who are developing some long-term care monitoring devices. Theirs is not so much a robot as a monitoring device specifically for nighttime falls, as you just asked in the question. And we understand from the nursing homes in the small scale qualitative studies that they've done with adoption that it does have an impact and motivates adoption, say from putting it in one level of the facility to all levels of the facility, when the caregivers and the residents report back that it particularly affects those nighttime rotations and the incidence of nighttime falls. Other questions?
Is there any way to tease out the spillover on physician behavior? Like, we understand all of this is happening and every nursing home probably has a couple of physicians. Are they feeling uncomfortable about it? Do they need to be educated about it? Does that change their productivity in some way?
Right, yeah.
Yeah. Go ahead.
Ultimately, please. We would love to get to productivity effects. And we are seeing hints there about staffing per resident and wages and outcomes we'll get to in our own survey. Physician-specific effects are much less sort of the focus of the nursing home context. The larger ones do have a full-time physician on staff, but most of them have a part-time or someone who comes in. So a lot of the clinical care is provided by the nurses, and then a physician will come in. We do have data on perception of appropriateness of use of robots, but those are self-report from the managers of the facility, and other surveys are from the clients. So we don't necessarily have physician-specific measures of those. But as you know, medicine is by no means immune to the proliferation of use of robotics technologies in many forms. So you can talk to like radiologists and surgeons about that, right? And they're not so common in nursing homes, but it is an interesting question about the perceptions. And interestingly, one of Japan's national policy goals was to increase the percentage of people who said it was appropriate to use robots in care, right? So that speaks to your question, is that there have been many people that perceive it not to be appropriate, and it's been an explicit goal to change that, not necessarily by force, but to subsidize use and then try to monitor it and see how comfortable people are with these technologies. And I think what we're finding is that mostly nursing homes are using robots to supplement their current workforce and to upskill them in a way that, as long as the robots are not malfunctioning and so on. I mean, we have data on that. And one of the primary concerns are malfunctions in time to use and awkwardness, as you may know, but also things like room to store the robots or money to maintain them. All these kinds of issues come up. But as long as those factors seem to be outweighed by the benefits, then you might see these attitudes changing over time and use changing over time. And that would be consistent with what we're seeing, but I can't claim that it's causal.
Sure, sure. And one other thing that if I was a referee, I would be thinking probably, and I'm sure you and Toshi have thought about it, is this internal validity question. All of this is happening in Japan, and Japan is historically technology friendly, aging country. They need it. They will make it happen in some way. But suppose you don't have Japan and have a country which is not technologically friendly. What could be the ethical barriers to running a RCT with robots in place and in some similar type of treated nursing homes and control nursing homes? I was just trying to think through this. You have some thoughts there generally if you want to run an RCT of robots' effects on productivity and wages and patient outcomes? Is someone doing that? Any group doing that?
Well, yeah, we were in discussions about doing that, but it's not a good time to run an RCT in nursing homes right now, certainly not in the United States. So obviously there are many ethical issues having to do with technology and honoring people's own preferences. But there are many opportunities to look at that nexus of where technology can augment rather than replace, and sort of allow caregivers to focus on the compassionate interaction side rather than the mechanical side. So it's not like the clients actually having the caregiver come around and do their rounds every 2 hours is not good for the client. The clients don't like it. Often it wakes them up to have people coming into their room at night, and they already have trouble sleeping. So if we find that nexus where you can respect the privacy and confidentiality. I mean, one thing with monitoring robots is that nobody really wants to have a camera in their bedroom, right? And older individuals are no different from the rest of us in that respect, right? So you have to work on technologies that are appropriate given the context. And I think RCTs definitely are going to be needed at some point. Once you respect all those questions, it's really is a gold standard to figure out what's going on, because there's so many different factors at the individual client level, at the caregiver level, at the management, at the facility level, at the technology level. The technology is not static either. Part of the subsidies is trying to improve the robots. So what we're seeing in 2019 will be different robots for the ones you saw in 2017, and can help with specific kinds of tasks rather than other tasks. So I definitely think it's what we need, sort of a mixed methods approach, and RCTs at some point. Japan, again, is an important case study because of the labor market conditions. It makes a lot of sense to do it there. I mean, other places where you have a lot of unemployment and low-skilled workers who are looking for jobs, it really just does not make sense to be promoting automation over addressing that labor market need, right? So again, that's another ethical dimension of thinking about how you're going to study the rollout of this technology.
Great. That is awesome. I know you have to go for a meeting, so let's wrap up, I suppose. Yeah.
Yeah, well, I don't need to run through the conclusion. You can see it there. I mean, our basic point
Sure.
is that adoption of these technologies depends on the context, the economic and social context where you're studying it. And you may hear from one JPE article about it being very negative, both for wages and employment in the United States, but there's the rest of the world in different settings also, beyond industrial robots. So I think this is, our brave new reality going forward, to try to figure out that nexus of changes in our populations, in our economies, in our technologies, and figuring out how to measure those important issues you brought up about outcomes and productivity. That's where we're going with this. My final point there is that we fielded our original survey early this year. We'll have more detailed information on robot adoption and nursing home quality. So stay tuned, and thank you for listening.
Thank you, Karen. And there was one question about why is it that the preference for employment shifting is towards non-regular employees after adoption? My sense is it's a task composition effect, but you may want to respond to that.
Right. Yes. So might note that it's a general trend in Japan and actually elsewhere that you have some tasks that are appropriate for a full-time, very much relationship-specific investment of full-time employees. And then you have other tasks where you can have non-regular workers. So these might be workers that work part-time or at multiple different facilities, or for their own reasons have like their own caregiving and going in a specific time of the day, don't have full benefits. Interestingly, we have a larger share of non-regular nurses in large metropolitan areas in Japan rather than rural areas. So it's not that it's correlated with the lower levels of development and so on. It might be in areas where people have, higher opportunity costs of their time. That said, non-regular workers have lower benefits, right? So it could be a pure substitution of the firms that trying to, reduce their wage burden and gain those same skills without paying as many benefits. But it seems like there's sort of a re-optimization of the staffing that they need that is complementary to this technology. So another thing we have to look at going forward. But we did think that there might be some shift towards the non-regular. That's why we looked at that, not just full-time, part-time, but non-regular versus regular. And that is something that we see both in this survey and in our own survey.
Super. So we are very much on time. And if anyone has any questions, we may have like 2-3 more minutes to ask her questions. Karen has been doing a lot of work in Asian health context. So China has been her lab for a long time in some sense. And we have been sharing notes on Asian health policy also for some time now. Any other questions, please share. Otherwise, she has a meeting in 10 minutes, so we should let her go, I suppose.
Yeah, well, thank you all for listening, and hope it's somewhat interesting. And look forward to hearing your own research, Chirantan, and others.
Thank you. I see the Hoover Institution background on your picture,
Yes.
so I'm getting nostalgic.
It looks familiar.
Yeah.
Yes, I thought I would show that. Our sky has not been this
that
beautifully blue,
Yeah.
as you may know. We've had orange skies, but yeah.
Yeah, please stay
and that
safe.
building, that's, my office is in that building, but my card doesn't give me access to that building since March. I haven't been there. So just so you know how severe things are here. I have been working from home since March, and probably will be at least through March next year. So everyone stay safe out there. Good luck with productivity in your own research.
Thank you,
And
Karen.
let me know if you have questions. You can Google me and find me.
Thank you so much, Karen. Please stay safe.
Thank you.
And take good care.
You too.
Yeah, bye-bye.
Bye.